Good morning, everyone. We're just letting people come on into the room here. There we go. Good morning, everyone. My name is Erin, and on behalf of the Pennsylvania MGMA Board, I am pleased to welcome you to day 2 of our operations seminar. We had a great first day. I hope everyone enjoyed it, and I'm very pleased to welcome you all here to day 2. I am very thankful to have with us our sponsor for today. We have Justin Krentz here from Vertical Solutions. We're so thankful for all of our sponsors, and I'm especially happy to welcome Justin from Vertical Solutions. Justin, do you want to say a few words?
Sure, thanks. Thanks again for having us. As mentioned, my name's Justin Krentz, work with Vertical Solutions. We'll try to keep things brief here. I know everybody wants to get started, but we are a managed IT services firm that really focuses in supporting healthcare organizations. So, we partner with organizations on everything from dedicated help desk and on-site support of their network and staff, IT strategy and budget, security, compliance solutions, cloud migrations, hosted infrastructure, all of the technical aspects of your environment. Ultimately, our goal is really to allow organizations or practices to focus on providing service without having to manage the technology to support it. So again, thanks so much for allowing us to be involved. MGMA is a wonderful organization, and we really value our partnership. If anybody has specific questions or more information that they'd like to understand around Vertical Solutions, I'd ask you to please visit our website at www.verticalsol.com. Or if you have any specific technical issues that you're dealing with right now or would like to discuss or understand a little bit more about, I'll share my information out to everybody at the end. So please feel free to contact me directly. I'd be happy to have that discussion with you. So just wanted to say thank you again.
Thank you, Justin, and thank you very much for your support and sponsorship. We are very happy to have Matt Devino with us. Matt has become quite a friend. We've seen him a few times now, but we're always happy to have him join us. Matt is the Associate Director for Membership and Policy for MGMA's Government Affairs Office in Washington, D.C. We were just chatting. We're all getting happy to be able to get out and enjoy some spring weather, start to see some friendly faces. In his primary role as a government affairs member liaison, he works closely with our MGMA state affiliate chapters in the Eastern and Western regions. Before joining MGMA, Matt was a senior research analyst at the Health Management Academy, a health system executive member organization based in Arlington, Virginia. He holds a Master of Public Health with a health policy and management focus from the George Washington University and a bachelor's degree in human developmental and regenerative biology from Harvard University. We're happy to have Matt with us again today. Thanks, Matt, and take it away.
Thanks so much for the warm welcome and introduction, Erin, and thank you, Justin and Vertical Solutions, for providing the sponsorship for this session. And finally, thank you all for joining today to learn a little bit about what's happening in the federal landscape here in Washington, and all of our friends on Congress and in the administration making updates to all of the programs that we have come to know and participate in. I'm planning to give pretty high-level overview of all of the updates that I've seen on my end over the last several months. And here's a quick agenda outlining all of the items that I'm planning to cover. A caveat to this, I'm happy to answer any questions as we go along. I'll try my best to monitor chat in the Q&A module as this goes along in case you have any questions. In case I do miss any of that, I will take some time at the end. I'll leave at least 5 or 10 minutes to cover any questions then as well. So I will start with a quick discussion of the Medicare payment landscape with an overview of the MIPS program, as well as alternative payment models or APMs, those both arms of the quality payment program through CMS. And we'll touch upon the Medicare physician fee schedule as well, with some updates that you're likely aware of that took effect following legislation passed in December. And finally, some other federal regs that we're tracking. I will also spend some time covering updates to some COVID-19 financial relief programs, in particular the Provider Relief Fund, PPP, and Accelerated and Advanced Payments loans. And I will finish up with a congressional update, what's happening on the Hill here in Washington, and what we're expecting over the next few weeks and months. And finally, I will wrap up with a discussion of advocacy and member engagement. So I'm sure by now you've all seen your MIPS final scores for 2021 that are available through the QPP website. All of this is available there if you were to log in. All participants for 2019 MIPS that you reported last year avoided a penalty. That means I guess 4% saw a neutral performance and 96% will receive a positive adjustment with a maximum of up to 1.79% on their Medicare claims. There still is a MIPS extreme and uncontrollable circumstances hardship in effect. It will be automatic again for 2020. If you do not report your MIPS data, you'll automatically be given a neutral payment adjustment, which is a good relief, but you could also apply for neutral. That would have had to be done already. All of your 2020 data was due to be reported by the 31st of March. So of course, we won't see any of that data and see the true impact of that until later in this year once CMS reviews and analyzes all of that. But all of the 2020 data you just finished reporting will affect payment in 2022. So I just like to compare side by side to visually represent how the MIPS reporting for this past performance year will compare to the current performance year. Thankfully, there aren't a tremendous amount of updates following the final physician fee schedule that came out in the beginning of December, and then some adjustments that were made by Congress in their Consolidated Appropriations Act at the end of December. There really aren't very many changes to MIPS, thankfully. The adjustment to payment will still be a maximum and minimum of 9%. Still, we probably will not see anything close to that as we have not in the past couple of years. The reporting periods for all of the categories are not changing. The category weights are changing. So for this 2021 period, the quality category is decreasing from 45 to 40%, while the cost category will be increasing from 15 to 20%. Not a huge change, but that is how this program is designed statutorily for that cost category to slowly increase its proportion over time with no changes to PI or IA. For data submission, again, there are no changes, but I do want to note for any ACOs, APM entities, groups, and virtual groups, the CMS web interface is slated to be going away in 2022. So no direct change for most MIPS eligible clinicians, but if you are one of those entities that I just mentioned, it's possible that that interface will be going away and migrating over to ECQMs. We are going to be engaging in advocacy to extend that timeline because I know it is a large burden on especially ACO and APM entities. So hold on that, but just to note that is in the pipeline. The complex patient bonus will be going back to 5 points unless any further changes are made from 10. And then there will be no changes to the low volume threshold or certified EHR addition for 2021. So I'd like to just show another visual representation of what 2021 MIPS performance will look like, with a reminder that your performance in 1 year affects payment 2 years down the road. So this year's performance will affect 2023 payment. Your neutral performance is increasing from 45 points in 2020 to 60 points in 2021. I think this is really achievable for a majority of groups. I think most participants from 2019 even were hitting above 80 points. The maximum negative adjustment will come into play if you score 15 points or less, and the additional adjustment factor that gets you some additional money that's allocated will be 85 points and above for exceptional performance. And that'll be the threshold for where you could actually see some positive adjustments on your Medicare claims in this program. Anything between 60 and 85, much less likely to see anything significant. Now to talk about the other arm of the quality payment program, that would be alternative payment models. These, in particular, the advanced alternative payment models actually allow eligible clinicians to not have to report for MIPS, and also becoming a qualified participant gets you a 5% APM incentive bonus. So there's your incentive for participating in one of these innovative models coming out of CMMI. That's the Center for Medicare and Medicaid Innovation. On the left-hand side of the screen are the advanced APMs for 2021. Some of these have extended model timelines due to COVID-19 that are continuing into this year. And then on the bottom, I've highlighted some of the new ones that are just beginning participation for the first time in 2021. That's Primary Care First, which started January 1st of this year, and the direct contracting model options. That's the global and professional tracks of that model actually just began April 1st. The Kidney Care Choices model options was due to begin its performance this year, but CMS has delayed that performance year one to begin instead January of 2022. So we're currently just in an implementation phase for any nephrology practices that might be listening or interested. I do just want to also highlight that following that Consolidated Appropriations Act that was signed into law at the end of December, the QP thresholds required to achieve the APM benefits mentioned were frozen at 2020 levels through 2023. So to become a QP, it's still just 50% of Medicare Part B payments or 35% of Medicare patients through that advanced APM entity. We engaged in a lot of advocacy to prevent those thresholds from increasing to unreachable levels in this year and in coming years, and thank Congress for taking action to prevent those thresholds from rising. So I want to take a couple of minutes just to quickly outline some of these new APMs, and I don't want to spend a ton of time on them because I know that they will not apply to the vast majority of MGMA members, but in case it does apply to you, the PCF program, Primary Care First, is available in the greater Philadelphia area. And so that first cohort began, as I mentioned, in January, but there is a second cohort that's slated to begin in January of next year. So if you're a primary care practice that's currently in CPC Plus and considering this new program as CPC Plus is ending, there is an application open for the second cohort, and that application period has been extended now through May 21st. So you have about another month if you do want to apply to participate in this program. CMS is also making some changes to the direct contracting model. They're now calling it the GPDC model, or the Global and Professional Direct Contracting model. That emphasizes the two different options for risk sharing arrangements or capitation that are available in this model, and they've really are moving towards either completely restructuring or eliminating the geographic option. It's back under review by the department. About 53 entities began participation in this model for the first time on April 1st. And just this past week, CMS actually announced that it won't be accepting new applications for the second cohort beginning January 1st of 2022. So it's only allowing entities that previously applied or completed a request for interest and were accepted, but deferred their participation for a year. So this is a change to what they had previously said, which is that they were opening another application period, and that would have attracted potentially practices that are rolling out of next gen ACOs. So this is going to be a bit prohibitive for those practices that were considering this model for 2022. I know there's going to be a lot of stakeholder pushback, and I anticipate that they might change that policy as the year goes on. Finally, I do want to mention the radiation oncology model. This is not taking effect now until January 1st of 2022. I know we talked about this a few times last year, and the date has been getting pushed back. Congress did take action in that December legislation to mandate a delay to this program start from July 1st of this year until January 1st of next year. So important for any radiotherapy service providers. It is a mandatory model, unlike all of the others discussed that are voluntary and application-based. This one is mandatory participation. So thankfully, there's some additional time to get up to speed for those practices that will be mandated to participate. But it is just limited to radiotherapy service providers and oncology practices in particular. So I do want to touch upon a couple more updates to the Medicare payment landscape, and that in particular touches upon the Medicare physician fee schedule conversion factor. And mentioned several times now that legislation that was passed and signed into law at the end of December of this past year really did significantly impact Medicare payment for this year. Congress took action at the last possible second. But thankfully, it did change what had previously been finalized by CMS as the conversion factors for the physician fee schedule and anesthesia fee schedule for 2021. So those are significantly higher than they were supposed to have been, although still lower than 2020. That legislation also added some money to the budget to help increase that conversion factor. It's further suspended the sequester, reinstated the gypsy floor through 2023, and delayed implementation of one of the new E&M codes, which I'll mention in just a moment, until 2024. So taken all together, we're still seeing about a 3% decrease to both of those conversion factors from 2020. But if you'll remember to last year, when I was presenting about the proposed fee schedule or finalized fee schedule, that was actually due to decrease by about over 10% for each of those conversion factors. So not as drastic as we were expecting. This kind of shows visually how the conversion factor fits into the Medicare service payment calculation. I know I've probably shown this before, but as a recap, it sits at the front. All of your RVUs and gypsies sit in the middle. You get your MIPS conversion, your MIPS adjustment following that, and then the sequester, which has just yesterday, I guess about 8 p.m. last night, Congress passed a continuation of the sequester moratorium, meaning that 2% negative adjustment to all of these payments will not come back into play until at least January 1st of 2022. So that's been further extended as of last night. I do want to point out a couple of E&M updates. If you are an E&M coder, you definitely know this stuff already because you've been doing it for the last 3.5 months. But as mentioned, that piece of legislation delayed the implementation of G2211 for visit complexity until 2024. So there's no impact of that on the physician fee schedule or coding. However, G2212, or the prolonged time code, is now in play, and that allows an additional payment to be tacked onto E&M visits for each additional 15 minutes by the physician or healthcare professional, either with or without direct patient contact, but on the day of the visit, and can be used for each time unit above 15 minutes of the maximum for either new or established patients when billing for time, not MDM. Complicated stuff. I know that if you're someone billing E&M, you know this all already. So I don't go into a tremendous amount of detail, but there are a lot of resources to help with this if there are any questions. We'll link here on this slide. I want to finish this section on Medicare payment by just outlining the changes to telehealth, since they are pretty significant and were finalized in the physician fee schedule last year, there were some permanent additions added to the Medicare covered telehealth list that are outlined on the left-hand side of this table. There are also temporary additions that are going to be covered until the end of the calendar year in which the public health emergency for COVID-19 ends. So at a minimum, all those codes on the right will be covered through the end of this calendar year, given the PHE has continued until now. If it continues into 2022, all of those codes will be covered through December 31st, 2022. Really subject to the public health emergency, which brings us to the question, is the public health emergency going to be renewed again? I think the Biden administration has given us every indication that it will be extended again. It's currently set to terminate about a week from today, Monday, April 20th. I guess that's just about 5 days from now. So we have been getting a lot of questions lately that we haven't seen it be renewed yet. I just checked again this morning. It hasn't been officially renewed, but I don't see a world in which this will not be renewed. And previous communication from the administration has indicated they do anticipate that it will, continue through the end of this year. It does need to be renewed every 90 days. So I do anticipate that in the coming days, we will see another renewal of this determination. So that means a continuation of all of these flexibilities and waivers that were implemented back effective March of last year that are outlined here on the screen. And so everything that you've been doing on telehealth will continue so long as that public health emergency declaration is still in effect. I want to finish up this section by just addressing a couple of other federal regulations that we've been tracking. The biggest one and one that's been creating the most questions on our end is around health information technology, and that are these ONC and CMS rules implementing the 21st Century Cures Act. These regulations are essentially have multiple different parts to them for the purposes of increasing interoperability among systems, both technology systems between medical practices and health information exchanges, payers. There is some edge towards reducing administrative burden, but there's also this information blocking piece, which just went into effect on April 5th. So this is mandatory compliance for medical practices to not be an information blocker, quote unquote, under these rules. MGMA has produced a very useful toolkit that explains the ins and outs of that piece of the rules. But that compliance date has come and gone. There is still not penalty or enforcement rules to go along with that compliance. So we're unclear at this point what will happen if you are found to be an information blocker. The administration, the office of the Inspector General has not put out even a proposed rule saying what civil monetary penalties or other sort of disincentives there will be for information blocking. So we're in a bit of a gray area at this point. I'd encourage you to take a look at that toolkit and avail yourself of the 8 exceptions outlined there should you run into any issues with information blocking until we have more information on that. I also want to address the appropriate use criteria program, which we've been talking about for what feels like probably 2 years now. The implementation of this was pushed back again last year until January 1st of 2022. So we are still in that educational and operational testing period. If you haven't began implementing this yet, perhaps wait until the second half of this year, see if it's pushed out or changed any further. Finally, I just want to address the most favored nation model. We haven't heard any mutterings about this lately, and that's largely because it's been put on hold until further rulemaking. This would have been a mandatory nationwide model for Medicare suppliers, particularly those that are administering certain types of drugs that are infusion-based, a lot of them in oncology care settings. So this model did not go into effect January 1st as it was intended to when that final rule sort of dropped out of thin air last year. So many are, having a sigh of relief at this. I don't think we're going to see any more movement on it in the near future. And in the best case scenario, it might just go away completely because it would take additional rulemaking to sort of revive it following that US District Court decision. So no immediate need to worry about that at present. So I'm going to switch gears a little bit and give a quick update on some of the COVID-19 financial relief programs that many of you are likely participating in or have sought some loans or grant payments from over the last year. The first one's the Provider Relief Fund, which many of you are likely familiar with and have likely received funds from. There isn't really a lot that's happened over the last few months in this program since the Biden administration came into office. They have really been silent on this program. They haven't opened up to any additional applications for general or targeted distributions of it. Congress hasn't really taken any additional action since December, adding some additional money to the Provider Relief Fund. And so we're kind of at a stagnant spot now, including for reporting purposes, which I'll mention in a second. But here's an updated look at what the allocations look like. The right-hand side outlines all of the general distributions. Those are probably most likely where money you've received came from. Initially, it was just open to Medicare, then expanded to Medicare and CHIP providers, and then finally all previously ineligible. That phase 3 gave not only that 2% of patient care revenue payment, but an additional payment covering up to 88% of reported losses for 2020. So you could have gotten a pretty significant payment from phase 3 if you did apply for that. Our calculations are looking about that there's about $26 billion left in this pot that hasn't been distributed yet. That may be a little less, as there was some speculation that 10 billion may have been taken from this pot towards Operation Warp Speed last year. And Congress is now asking HHS to report on how it spent these funds or allocated these funds, and we're still waiting to see that testimony or hearing from HHS. But as we are currently looking at this, the main action item right now is reporting on the use of these funds, which many of you received last year or earlier this year. And there really is no update here other than the reporting portal is open, but it's open only for registration. They have not opened it for you to be able to actually report how you used funds, to show proof of receipts or allocation towards lost revenue, nothing of the sort. They have not updated the reporting requirements document since January 15th either, although HHS has been silently making edits to their FAQ on the Provider Relief Fund, particularly around ownership arrangements and other sorts of parent and like ownership sort of structures as it pertains to reporting. So it may be worth taking a look at that, but they have not publicly made any announcements about this program and have not opened up that portal for actual reporting at all. So we are in still a bit of a holding pattern on the Provider Relief Fund as well. So I continue to make sure that this resources checklist is available. And yeah, I just want to emphasize, continue checking out those FAQs. They just, in the past couple of weeks, have even modified and added some more, although they haven't made any other changes to their Provider Relief Fund landing or reporting and auditing pages, which I also continue to monitor. And if you have received any additional payments, each payment received from this program does require an attestation and acceptance of the terms and conditions within 90 days of receiving payment. So if you got a phase 3 payment in the last few months, make sure you do go and attest in the attestation portal on the PRF website. I want to talk about the PPP as well, which has seen a lot of legislative action that continue to make changes to this program. What seems like every several months, there's a new piece of legislation amending the PPP. So the last piece of legislation that passed in March was the PPP Extension Act of 2021 that just extended the application period for additional PPP loans through May 31st of 2021. And it keeps in place the flexibilities that were introduced as a part of Consolidated Appropriations Act that was passed in December, allowing certain entities to get a second draw PPP loan if they meet certain criteria. Also emphasizing that if you receive one of these loans, you can apply for loan forgiveness and still deduct forgiven PPP expenses on your taxes. They were very insistent about that and took an opposite approach to the IRS previously. There's also now a simplified loan forgiveness process for loans under $150,000, which is a pretty significant amount, and makes your lives a bit easier if you receive a loan under that threshold. And also finally emphasizes that you can elect a covered period of between 8 and 24 weeks. It doesn't have to be 8 or 24 weeks. So some small tweaks to that program. Again, the loan forgiveness guidance has been pretty, it hasn't changed very much since any of these new pieces of legislation have come into play. There is now that simpler application for loan forgiveness for recipients of $150,000 or less. And the stipulation that you could identify a covered period between 8 and 24 weeks. But everything else kind of remains the same. I do just want to emphasize that you do need to apply for forgiveness if you want these loans to be forgiven within 10 months following the last day of your covered period to avoid interest from accruing. At that 10-month mark, you'll likely receive a notice from your lender that a 1% interest rate will be kicking in, and I think in 30 days from that date. So it's important to get the ball rolling on this now, just because I do know that the SBA and lenders have indicated that they are several months backlogged in processing these loan forgiveness applications. And so, if you're wanting to avoid that interest rate from coming into effect, certainly get a jump on this as soon as you can. The last relief program I want to mention is the Accelerated and Advanced Payments Program through CMS. It was an existing program that was just amended by the CARES Act to make it available to Medicare providers for the COVID-19 public health emergency. Congress did revise the repayment conditions of this program, I believe last fall, but now these repayment conditions are coming into effect, given that most providers receive these at the very end of March or early April of 2020. So repayment guidelines are now that, if you have not decided to pay back these loans as a lump sum to your MAC, that they will, your MAC will start recouping the amount of the loan from payments that they owe you. So it'll be in the form of claim withholds. The MACs have been instructed by CMS to recoup and show the recoupments on remittance advices for both Medicare Part A and B claims following the 1-year date of when you received this loan. And so that will appear as an adjustment in the provider level balance section. I do want to point out that there is some legislation that would further delay this recoupment timeline or even convert these loans into grants. I don't necessarily see those pieces of legislation moving, but it is being talked about in the House. And also, given that these recoupments have now started, it would be difficult to stop the recoupment and then, begin it again in another 3 months, which the bill linked here would do. But we will see, and we are continuing to track that for anyone interested. So while I am on the topic of Congress, I do want to just cover what it is that we've been seeing happening here on the Hill, and what we anticipate happening over the remainder of this year. So it is a bit of a different conversation now, especially following the Georgia runoffs that have given Democrats control of the Senate, although very, very small control. But now with control of both chambers of Congress as well as the presidency, we do think that some healthcare issues will come into play, particularly in the latter half of this year. So COVID-19 is continuing to dominate for the present time. Also, the president has focused now on his infrastructure package, which is being taken up by the House. The House is having a number of hearings on that infrastructure package, and there aren't very many direct consequences or pieces of that package that will affect the healthcare landscape outside of potentially graduate medical education. But we are told by staffers on the Hill that following the presumptive passage of this infrastructure package and the hopeful subsiding of the COVID-19 pandemic over the coming months due to vaccination, healthcare reform and drug pricing will re-enter the conversation and demand a lot of attention in the latter part of this year. So Senate Democrats are continuing to rely upon this reconciliation process to be able to pass legislation with a simple majority rather than the necessary 60 votes for passing legislation normally in the Senate. There's also continuing conversations around the filibuster and potentially addressing that, although there seems to be less interest across the party for removing it altogether. But in the space of healthcare reform, there are starting to be mutterings of a potential of lowering the Medicare age or a buy-in potential, as well as creating a public option called Medicare X. There have been several bills introduced on both the House and Senate side, so there's a lot of interest there for healthcare reform to build upon the Affordable Care Act. As well as in drug pricing, which is more of a bipartisan conversation, but something that both sides would like to see happen in some way, shape, or form. Again, those things likely will not enter the picture until the latter half of 2020, following the passage of any potential infrastructure package. I also mentioned earlier that sequestration just passed last night, or rather a moratorium on the sequester through the end of this year. So the House just came back from its April recess earlier this week, and last night they passed this the same bill that the Senate passed, which would delay that 2% Medicare sequestration from coming back into the picture until next year. Which is good news, as it was due to come back into play April 1st. MACs are currently supposed to be holding claims with date of service on or after April 1st, so they don't need to reprocess them. But now that we're expecting, I don't know if the president has signed this bill yet. It'll probably make its way to his desk today if it hasn't yet to be signed. So there's a sigh of relief. However, there is a second piece of this that comes into play due to the American Rescue Plan. That was the last COVID relief package passed by this Congress just a couple months ago. And as a result of that reconciliation process, a 4% new sequester could be coming into play beginning January 1st of 2022. So Congress would need to step in and pass additional legislation to waive the pay-go or pay-as-you-go rules to avoid that new sequester from coming into effect. That's a potential 6% cut in 2022. I'm not really imagining a world where this doesn't get waived, but currently, because of the highly politicized nature of the American Rescue Plan and the fact that it was passed with only Democratic votes, Republicans are taking a hard stance and waiving anything that's coming as a result of that plan, and kind of using it as a platform over the next several months likely we won't see any movement on that until closer to the end of this year. I also want to touch upon telehealth, which continues to be a very important avenue for conducting visits and communication with patients. MGMA does support updates to Medicare telehealth that would extend these sorts of flexibilities that we've seen during the public health emergency beyond the end of it, and especially to ensure that there isn't a cliff when the public health emergency does finally end. These two pieces of legislation were introduced in the last Congress and would need to be reintroduced in the 117th. We haven't seen them specifically reintroduced, but there have been a number of hearings on the House side of things. MGMA submitted testimony for some of those hearings in support of telehealth flexibilities. And so we are waiting to see what sort of legislation gets introduced in this Congress. Finally, I do want to mention prior authorization as another topic that MGMA continues to advocate for in terms of improving and streamlining that process. There was a bill introduced last Congress that MGMA helped write that would affect Medicare Advantage plans and help PA to become a much easier and simpler process. That bill was not passed or taken up, but the sponsor of this bill that we continue to work with has informed us that she does in some form plan to reintroduce this bill in the new Congress. So we're continuing to work with her towards that. So I do want to just end here and open it up for questions in just a minute by highlighting some MGMA advocacy and member engagement. 2020 was obviously a tremendously difficult year for everyone, for businesses, for individuals, and for medical practices especially. But MGMA was able to come away with many what we consider to be wins over the course of the last year to help with the financial solvency of medical groups and ensuring access of patients to their providers during the public health emergency via telehealth. So we created a nice infographic kind of emphasizing those things and especially highlighting the involvement of members via grassroots letters and our Contact Congress portal. Many of you probably got on there and helped submit letters to your members of Congress in support of all of these items. And so we encourage that again, moving into 2021, particularly around some of our outstanding asks. So as mentioned, a continuation of those telehealth flexibilities beyond the end of the public health emergency. We got an automatic MIPS hardship, thankfully, for 2020, but would like to see it again for 2021. A continued suspension of the sequester and the potential new sequester through at least the end of the public health emergency, as well as including medical groups and vaccine distribution, and finally, some more guidance around the provider relief fund distributions. So for any of those things and others, you can go to mgma.com/contact Congress. You don't need to have a member login. You don't need to be a member. You could very easily log in, find your members of Congress, and help send grassroots letters directly to your members and advocate for yourselves. That grassroots involvement is just a piece of our advocacy feedback loop. I always share this, so I'm sorry if you've seen it before, but I do want to emphasize how important it is that we, in doing presentations like this, that it helps gain some involvement. If there's any feedback you want to provide to me at the end of this, or submitting any questions or comments, I'm happy to take a look at those in the time that we have left. But that all kind of feeds back into our meetings here in Washington with both members of Congress and the administration, and working with other stakeholder groups and building coalitions and advocating for the best interests of our members. So I can't emphasize enough how much your involvement is important in that entire process. Finally, I encourage you to sign up for the Washington Connection. That's our government affairs weekly newsletter that comes out every Thursday morning. You and colleagues, anyone could sign up for that without any sort of membership obligation. Members can also call to speak with government affairs on our line or email govaf@mgma.org with any questions. And finally, for national members, we do have dedicated e-groups that have been really helpful in being a sounding board for members over the last year, especially. So at this point, I do want to stop yammering a little bit and see if there are any questions that I haven't seen come through, or if anyone has any comments or anything.
Thanks, Matt. We do have the chat box there, guys. If anyone has any questions that they'd like to ask, we are happy to have the questions, and we do have a few minutes before we need to pop into our next session. Are there any questions for Matt? We'll give it a minute. Well, I want to take the opportunity to thank Vertical Solutions and Justin. Thank you for being here. I really appreciate your support and your time today, Justin. Thank you, Matt. Everyone, you're a great resource, and everyone knows that they can get in touch with you if they have any questions. I appreciate your time today. Yeah, Susan, thank you for your question. The slides and the recording will be available for all of our sessions. We will be sending out the slides and the recording for all of our sessions from the seminar. It usually takes us a few days to process everything, but you will get the slides and the recording for all of our sessions by email. Will be sent out to all of our registrants in just a few days. So thank you for the question, Susan. But I want to thank Matt for always being such a great resource for all of our questions. Thank you for your time today. Thank you again, Justin and Vertical Solutions. You all of our attendees have the link for our next session, which is going to be really great. We will see you all at noon. Thank you again, Matt and Justin, and everyone have a great day.
Thanks, Matt. Thanks, Aaron. Have a great day.
Bye-bye.
Thanks, Aaron and Justin.